So today we're going to talk about pancreatic cancer. We're going to give you some background information. So what is cancer generally? What is the pancreas and what does it do? A bit of pancreatic cancer. And then we're going to talk about risk and treatments about pancreatic cancer.
Generally, cancer is when cells in the body begin to grow uncontrollably. Cancer can start in most organs of the body and spread to other parts of the body. Cancer is a genetic condition, meaning certain people are more likely to develop cancer based on the makeup of their DNA, the unique code that tells your body how to grow. Carcinogens are anything that can cause cancer, such as UV rays from the sun, cigarettes, or formaldehyde. When cancerous cells start to multiply, the cluster they form is called a tumor. On the left, you will see a normal cell dividing, and on the right, you will see how a cancerous cell divides in the body. There are two types of tumors, malignant tumors and benign tumors. Malignant tumors can spread to other parts of the body and are extremely dangerous. Benign tumors do not spread to other parts of the body, but are still deadly. There are 4 stages in the development of cancer. Stage 0 is when the cancer has not spread anywhere. The first stage is when a small tumor has formed. The second and third stages are when tumors grow and spread to lymph nodes, but not other parts of the body. The fourth stage is when cancer starts to spread to other parts of the body.
Now for some background on the pancreas. The pancreas is the elongated spongy organ in the back of the abdominal area on the patient's upper right side, or if you're using your own body, upper left side. The pancreas has 4 regions: the head, also known as head proper, neck, body, and tail. The head is located at the point between the stomach and small intestine. This part is called the duodenum. The neck is located in the curvature of the duodenum. The body and tail are located upward into the left of the aorta of the heart and the left kidney. The stomach empties partially digested food, also known as chyme, into the intestine, and this is when the pancreas excretes digestive enzymes that further break down the food. The pancreas excretes enzymes and secretes hormones. The pancreas has both an exocrine and endocrine function. The exocrine refers to the gland system that secretes enzymes that are not released into the bloodstream, and the endocrine refers to the gland system that secretes enzymes into the bloodstream. Functioning as an exocrine gland, the pancreas excretes digestive enzymes into ducts that can connect to the main pancreatic duct. These enzymes break down nutrients in the duodenum. The enzymes are in inactive form when they move from the pancreatic duct into the bile duct, and are activated when they enter the duodenum. In the duodenum, the exocrine tissues also secrete bicarbonate to neutralize the acidity in the stomach. Functioning as an endocrine gland, the pancreas secretes the hormones insulin and glucagon to control blood sugar levels throughout the day. The gland has islets of Langerhans, which are endocrine cells, that secrete hormones into the bloodstream. The hormones primarily consist of insulin, which lowers blood sugar, and glucagon, which raises blood sugar. They both regulate the level of blood glucose.
So now let's talk about pancreatic cancer. So the most common type of pancreatic cancer is pancreatic adenocarcinoma. So this is caused by an exocrine tumor from the cells that line the pancreatic duct, known as epithelial cells. Endocrine tumors make up 5% of pancreatic cancers. So these refer to the cancers that arise from the hormone-producing cells in the pancreas. Let's talk about precancerous growths. Intraductal papillary mucinous neoplasms are precursors that are malignant. So this growth is a cystic neoplasm, which basically means it is a sac with a distinct membrane and in its abnormal growth. So this can be detected through an MRI or CT scan, and there are 2 types, a main duct and branch duct. The main duct of an IPMN can also be asymptomatic, but many times it can imitate symptoms of acute pancreatitis, which basically means inflammation of the pancreas. High mucinous fluid builds and it obstructs the pancreatic duct. Over here, you can see that branch ducts are typically found underneath the head of the pancreas. They are sometimes asymptomatic, and can also lead to acute pancreatitis or jaundice. Let's talk about a benign growth. So pancreatic intraepithelial neoplasia, or PANN, is a benign growth, meaning it will not spread throughout the body. So this is an abnormal growth of the cells lining the pancreatic duct. Dysplasia is an abnormal growth and disturbs tissue organization. Let's take a closer look at the pancreatic duct. This is what a normal pancreatic duct should look like, and this is what PANN looks like. You can see that it is uneven and much more closed up, and the normal one was in a relatively uniform shape.
Symptoms associated with pancreatic cancer often don't occur until the disease has advanced. The major symptoms include abdominal pain, loss of appetite or unintended weight loss, yellowing of your skin and the whites of your eyes called jaundice, light-colored feces, dark-colored urine, itchy skin, diabetes, blood clots, and fatigue. There is no way to prevent pancreatic cancer since some of the risk factors cannot be controlled, including age, gender, race, and family history, but there are some things that will increase your risk that can be controlled. The risk factors include cigarette smoking, family history of pancreatic cancer, chronic pancreatitis, obesity and diet, diabetes, workplace exposure to certain chemicals, older age, almost all people are above 45, gender, men have a slightly higher chance than women, race, African Americans are slightly more likely, and inherited genetic syndromes. There are many treatment options, but the most used treatments are surgery, radiation, chemotherapy, and targeted therapy. Surgery can include the removal of the tumor and the affected area or of the whole pancreas. Radiation therapy is much like getting an X-ray, but the radiation is stronger. It is typically given with chemotherapy or after surgery to lower the risk of the cancer coming back. Side effects of this include skin irritation, nausea, and vomiting. Chemotherapy can be used before surgery, after surgery, or on its own. It is given through an IV so that the drug is injected into the blood or given in pill form. An issue with chemotherapy is that it doesn't target just cancer cells, it targets all fast-dividing cells such as hair, skin, gut, and blood. Side effects include hair loss, skin rashes, weight loss, and chronic pain. Pain is often a major problem that comes up with pancreatic cancer, so there's also treatment to help relieve that pain.
From this video, you learn that cancer is when cells do not stop dividing and can spread rapidly through the circulatory and lymphatic systems to the rest of the body. The pancreas is responsible to further break down food and regulate blood sugar. Pancreatic cancer comes in two forms: exocrine tumors, which are most common, and endocrine tumors, which are less common. People can't eliminate their risk for pancreatic cancer altogether, but can reduce their risk by having a healthy body weight, limiting alcohol and cigarette smoking.